Well, hello, I am Maryjayne Aria. For those that don't know me, I've studied the 20 years this November of the intricacies surrounding Gcmaf, and today I am with Dr. Fermin Celma. His background is he was a general surgeon, and then didn't you work just for a time with Johnson?
Yeah, I did. Just for a brief time, but yeah.
Just for a brief time?
Yeah, exactly.
Okay. And I guess you learnt a lot from those days.
Exactly.
So, and Dr. Fermin Celma now works with largely Gcmaf and stem cells, is that correct?
Yeah.
And
right.
Today, let's focus on lung cancer, because you have excellent results with lung cancer.
Yeah.
And I know that you're using, of course, fenbendazole, and you're using ivermectin. So, and as well as that, you're using Gcmaf. I came to see you when I was in Kuwait at the same time as you, and I came over and you were treating that lady. She was in the late 60s, really nice lady. Do you remember her?
Yeah, of course.
Yes. And she was in hospital. And she really was late stage. And I mean, when I say late stage, this poor lady, she was really struggling. She had drains in, she was on support, full of ascites, wasn't she? Yeah. And she wasn't breathing alone. She needed aids of oxygen. And she wasn't eating or drinking. She was on IV and she was on supplementary foods. And being fed by the tube, basically. And then you suggested at that late stage, and it was a really late stage.
Mm-hmm. Yeah, the Gcmaf act so good with the...
But she was in hospital.
Yeah.
And you said to the family...
Yeah, we need to do that, yeah.
Okay, so what was the dosing of Gcmaf? What did you do?
Yeah, just we afford this in the hospital. We try to put the protocol inside.
Okay, what was the protocol with the lung cancer?
Yeah, so just put 1 milligram each day.
So that's 2,500 nanograms of Gcmaf, and that was sub-C in the stomach, I believe, just like injecting like a diabetic does, basically. Mm-hmm. So they did that in the hospital. What about nebulizing?
Nebulizing. Gcmaf too work very well with the lungs. We have very good results there, and yeah, we saw that.
But how long? I mean, I know this lady was draining so much, she had a permanent draining because of lungs, and she had liver cancer, didn't she? And you said to the family, if you can get her well enough and off that permanent drain, you promised to do stem cells. Mm-hmm. And this woman, she fought and fought and fought. I mean, fighting for her life with the encouragement of a family and everything, and with the other things that you were doing, and fighting against other things that they were doing in the hospital, of course. Because I think she started morphine at the time. Because she had also in the bones, I remember, because of the pain that she was in. She had radiation, which I think actually works quite well for the bones, especially when there's pain. But so she was nebulizing from the vial 0.5 and injecting 1 ml a day. How long until it was just days, maybe 4 or 5 days, wasn't it?
Yeah, we saw results.
Yeah, it was incredible. The fluids kept coming down and down and down. Day 10.
Yeah.
Day 10, she came out of that hospital. Yeah. And I met her, was it day 15 or 16?
Yeah, more or less. I don't remember so well, but yeah.
And I went to the house of this lady in Kuwait, beautiful house. And they had everything set up for this lady. And she was just incredible. So from being a late stage cancer with only a hope, let's face it, it was only a hope at that stage. She was recovering What was your biggest thing? I remember you saying something about diets to the family. You were not very happy at the time. What was it that they were doing?
Well, leave all the meat, leave all the cheese.
The dairy, that was it. It was the dairy.
Mm-hmm.
And so what is the importance, if we can just tell our viewers today, what the importance is of not having any dairy products when there's any kind of lung issue, even if it's COVID, it doesn't have to be lung cancer. Why is it that people have to avoid dairy?
Yeah, because you need to clean all the toxins and don't give enough sugar to the system and a lot of toxins there.
But for lung cancer in particular, doesn't it build mucus?
Yeah, exactly.
It builds extra mucus. This
all
is
the bronchioles need to clean, and we need that breathe better there.
Yeah, and just cutting out all dairy, meat and dairy, really made an incredible difference. Now, this was last year, folks, and this lady is now so strong and doing so well, and she had no more than 3 weeks to live. I mean, it was just incredible. And what do you think that worked? Oh, you did stem cells.
Yeah, right.
She got out of hospital and you did the stem cells. And she just went from here. She was zero. I remember she was a bit weak the next day after the stem cells. I remember her feeling quite tired. But these are naive little stem cells that don't know what they're doing. They just go in the body and they find out what's wrong. And with the liver in particular.
Right.
You only have to have 40% good liver, and stem cells go in and they regenerate the liver. The liver is the only organ that can regenerate. But it's important because your liver is the filter of your body, isn't it?
Right.
So with it being a filter, we really have to be careful, especially with protocols. People are putting all of these herbs in and all of these things too much. And that's not good for the liver because something's got to filter them.
Yeah.
So you in particular, this is where I really like you. You do blood work on all of these patients before stem cells. And you tell them from their blood where they need to improve their diet. And you take them off all of these supplements and just give them the diet. Not many people do that, not many doctors. They really don't. So with lung cancer, how long before you'd say that you normally see results? At the late stages, you see results really early, don't you?
Yeah, first with the lungs, later the liver, and obviously the kidneys for filter all this liquid that we have around all the system and all the body, and we saw the results so fast.
Yeah, amazing. So if it is that you have a lung issue or a loved one, Gcmaf nebulizing
it's the best advice,
is the best advice. Because now we've got all of these other new viruses coming out, Doctor. We've had COVID, we've had many variants of COVID, and the Gcmaf really saved me. It really did. It really did.
Even for the patients that have COVID
I
before,
remember couldn't breathe going up a hill in Turkey. I was with my husband. I was racing up that hill. My husband, as you know, is much younger than me. It doesn't mean he's always faster. No, he's younger than me. He's faster than me. I'm older than him and I'm wiser than him. And I always tell him this. But we were going up this hill from Hisham's, you know, and we were running all the way up there. And I was first up there. And we got to the top and I was like, yay, looking down as they're, you know, my husband and his brother coming up the hill very gingerly. And then there was this one day doing the same thing. I couldn't walk. I had to sit down and rest. I was like, I just can't walk. And my husband's saying, well, what's wrong with you? And I really couldn't breathe properly. And I got home and I didn't think of COVID. I really didn't. I thought, I don't know, I just feel exhausted. I thought I'd overworked myself and things. But then we were trying to leave Turkey. And of course, I got the COVID positive, and that was it. I was again in quarantine. But, you know, I took Gcmaf. I still had my smell. I took Gcmaf every day. I only had the spray. And I just sprayed it under the tongue. And within 24 hours, I really started feeling better. Not completely. It still took me 4 days to get over it. But my respiration was so much better.
Mm-hmm.
So I can really see how that works. I felt it myself. So yes, with lung issues, it's definitely, it's a game changer.
Yeah.
And I saw it with my own eyes. I witnessed it at your clinic, because always you send me documents on how your patients are getting along and studies that you've done with your patients. But it's not the same as seeing them in person.
Mm-hmm.
It really isn't. And anyway, I want to thank you for all the work that you do down at that 50 doctors.
Yeah, even I say for the same for the patient that had COVID, can use the Gcmaf and can have better results, because obviously the immune system come down. Yeah.
And as a preventative, of course.
Mm-hmm.
Why wait? For me, I think, why wait until a virus comes in? Why not keep your immune system strong?
Exactly.
Preventative. I'm all for preventative, but that's for another conversation.
Exactly.
That's for another time. For now, this was to discuss lung cancer and lung issues in general, any pulmonary issues, and Gcmaf. So thank you for today, Doctor, and thank you all for watching. That's goodbye from me, Maryjayne, Aria, and
Fermin Celma.
Fermin Celma.